Hello everyone. So today we are going to discuss about pathophysiology of lung abscess. So lung abscess is basically defined as localized area of necrosis of lung tissue with suppurative degeneration. That means necrosis in the lung tissues, and it might be cause pus formation or necrosis. Firstly, there is dead tissues, and after that, because of dead tissues there are cavity form, and because of this cavity there might be pus formation, and it mainly leads to the abscess formation. So it is of two type, and these are primary lung abscess and secondary lung abscess. So in primary lung abscess developed in normal, so it is developed in normal lung, mostly single and large, commonly due to the aspiration of infected material, localized most frequently in the lower part of right upper lobe or apex of the right lower lobe. So the abscess may be formed in the lower part of upper lobe, or may be the apex of the lower lobe, or and it is one single and large, or it may be caused due to aspiration of infected material. And secondary lung abscess is developed as a complication of some other disease of lung, or from another side, mostly multiple and small, most commonly post-pneumonic and following septal embolism. So secondary lung abscess is happen because of the complication of some other diseases, and it is mostly multiple and small. It is as you can see, it is multiple in number, and it is smaller than primary lung abscess, and most commonly post pneumonic or following septal embolism. It is most commonly happen with previously having pneumonia. So now we are going to discuss about etiology, etiopathogenesis. So there are some causative organisms. These are Streptococci, Staphylococcus, gram-negative microbe. So the causative organisms are Streptococci, Staphylococci, and gram-negative microbe. And the mechanism by which they enter the lung is, first one, aspiration of infected foreign material. So aspiration of food, decaying teeth, so patient who is having teeth decay, and gastric contraction, necrotic tissue from lesion in mouth, nasopharynx, and upper respiratory tract can cause the lung abscess. And the favorable condition of this lung abscess, so the favorable conditions are sleep, unconsciousness, alcoholism, anesthesia, etc. So patient during this time, during sleeping time, during unconsciousness, and who is having alcohol consumption, and during anesthesia time, patient might be having this aspiration pneumonia most commonly. And the second point is preceding bacterial infection. Conditions are like bronchopneumonia, tuberculosis, broncholectasis, and third one is septal embolism. So infected emboli originated from pyemia, thrombophlebitis, or from vegetative bacterial endocarditis may be disseminated in venous circulation and reach right side of heart, from where they are lodged in the lung, and the resulting multiple abscess formation. And fourth one is bacterial obstruction. Obstruction due to bacterial tumor or foreign body mucus secretion occurs first line of the defense mechanism. So abscess formation occurs behind obstruction. And also there are some miscellaneous causes of abscess formation. Those are infection in pulmonary trauma to lung, direct extension from suppurative focus in mediastinum, saprophrenic area, and esophagus. So now we are going to discuss about the morphological features of lung abscess. So from here, the morphological features, the main part of pathology of lung abscesses start. So this morphology of features mean where the abscess is located, the location of abscess. So the abscess is located in the lower part of right upper lobe or the apex of right lower lobe. As I already explained this thing, that the location of the abscess, and the lung abscess secondary to aspirate of foreign body is more common in the right lobe of lung, because the right bronchi is in the direct continuation of trachea, and they are often solitary, whereas the abscess from other cause are usually multiple and scattered through the lung. So in exam, if it is come like what is the morphological features of lung abscess, we can write this part. And now we are going to discuss about the gross examination. So gross examination means the size and the shape of the abscess. The abscess may be of variable size from a few millimeter to large cavities. So it might be small and might be a bigger one. That means large cavity. The wall is usually sluggy with ragged margins. Initially, abscess has poorly defined ragged walls. With time develop fibrosis, fibrous wall cavity, often continuous exudate. So when time goes with the time, the abscess might be bigger, and it might be formation of pus formation. It might be formed pus and exudate. In morphological features, in microscopy, we are going to discuss about the microscopic examination. Under the microscope, what we can see. So in microscopically, destruction of lung parenchyma with suppurative exudate in the lung cavity. The cavity is initially surrounded by acute inflammation in the wall, but later there is replacement by chronic inflammatory cell infiltrate composed of lymphocytes, plasma cell, and macrophages. So now we are going to discuss about the last part of lung abscess. This is clinical features. So what clinical features we can see during the lung abscess? So the clinical manifestations include high fever. Patient might be having high fever with chills. Chills means patient might be having shivering, and after that malaise, cough with purulent sputum and hemoptysis, and clubbing of finger and amyloidosis occurs in long standing. If a patient is having this lung abscess for a long duration of time, that time the patient might be having clubbing of finger and amyloidosis. So thank you everyone.